Please, before you get back surgery, follow these 5 recommendations. After this, only a small percentage of people actually need surgery. Hi, this is Dr. Hobbs, restoring hope and health for lifetime family wellness. So I'm not a surgeon, I'm a chiropractic neurologist, and I help people avoid surgery. Some of these guidelines come from Dr. David Hanscom, a board-certified orthopedic surgeon who specializes in surgical correction of complex spinal problems, or at least he did until he gave up that lucrative business for a focus on helping people know how to relieve pain without surgery. Other information comes from Dr. Stuart McGill, a spinal injury and rehab researcher and therapist, and some information comes from my over 20 years of exam, diagnosis, and treatment of spinal damage and dysfunction. So recognize these recommendations are for someone already considering surgery. With most people, they just skip right to step 4, the conservative therapy. But for those considering surgery, let's start with their present considerations. So let's get right to it. The first of the 5 comes from McGill. So first, perform virtual surgery. Pretend that you had surgery today. Often the activity you won't stop, or even the exercise you think is promoting recovery, is what keeps you hurting. So take it easy, restrict your activity, and gradually reintroduce the activity as the days go by. Second, ask the surgeon what pain generator they will remove. They're cutting stuff out, right? So what is causing the pain that they're cutting out? Will they get it all? What pain generator will they leave behind? These seem obvious, but they're very tough questions since the brain is where tissue signals are interpreted as pain. This is the realization that Dr. Hanscom came to embrace and address. Third, clarify the success rate. Still talking to the surgeon. Is success pain reduction, and for how long? Is success no repeat surgery and no additional surgery, and for how long? Ask to talk to a couple of former patients to help clarify these expectations, at least for the best case scenarios. Fourth, deal with the pain. I always hate to say this, but in the words of the experienced spine specialist, author, and researcher, Stuart McGill, patients who have severe pain for only 3 weeks, I added only 3 weeks, and then have surgery, have been some of the most disabled post-surgical cases I've seen. Deal with the pain and pursue conservative options. You can always get surgery, and even after surgery, you still must manage your spinal health and likely the residual pain. This takes us to our last step. The 5th, exhaust conservative options. This whole video series is about conservative options. I'll summarize here, then link to several of the videos below, and I'll provide a link to browse the whole playlist, or you can simply text the keyword BACK, B-A-C-K, to our office phone number and receive a video every day or so, straight to your device for a month. All right, conservative options fall into 4 steps. Conservative step 1, stop causing harm and brace as needed. It's amazing how many ways we cause harm. Here are a list of 4 that we address. 1, avoid known and unsuspected harmful exercises and activities, including certain back exercises and lifting and carrying correctly. Number 2, stabilize the unstable sacroiliac joint. 3, this also includes stress chemical inflammatory cycle. So I'll do a whole separate post on stopping the harm of the stress chemical inflammation cycle. This is the specialty of Dr. Hanscom, the surgeon. And number 4, finally, stopping harm includes correcting the gut and nutritional chemical inflammation cycle. All right, next, conservative step number 2, restore nerve communication. This includes chiropractic for restoring brain-body nerve communication, includes inversion table to unload the spine, and non-surgical spinal decompression to reduce the herniation, open the spaces, and rehydrate the discs. Conservative step number 3, remap nerve coordination with specific and appropriate exercises of the core. Core training different from strengthening for restoring brain-body nerve coordination. This is where quality physical therapy and Pilates instructions come into play. Conservative care, finally, number 4, build endurance and tissue stability. This is basically continuing to do what helped you recover to this point, but with more force and frequency. Okay, that's the 5 things to do before back surgery, and including the 4 conservative steps. As a quick review, first, perform virtual surgery. Second, ask the surgeon what pain generator they'll remove. Third, clarify the success rate. Fourth, deal with the pain. Fifth, exhaust conservative options. And these include 4 steps. First step, stop causing harm and brace as needed. Step 2, restore nerve communication. Step 3, remap nerve coordination. And 4, build endurance and tissue stability. Those 5 things sure do include a lot. Yes, that does make a point. There's a lot that can be done before surgery is required. Of course, it doesn't take doing all of these for most people. And in fact, most people who aren't considering surgery yet, we skip right to conservative and they do quite well. All right, so do what you can, do what you must, and have a great day.